Hi, if you haven't already done so, please go ahead and turn up your volume so you can listen to this very important video about neuropathy. I'm going to show you how our treatment program can help or reduce and eliminate neuropathic symptoms and help you return to a normal life. Some of the results that our patients are already seeing in our office are things such as a reduction or elimination of the numbness and tingling in their hands, feet, and legs, improved nerve endings and healthier nerve linings, a reduction in their pain or burning sensations, improved coordination and balance, and in many cases, even a complete reversal of their neuropathic symptoms. Hi, I'm Dr. Rob Scranton. I'm founder and clinic director here at the Scranton Clinic Neuropathy Treatment Center, and I just wanted to talk to you about what we do a little bit. We focus on helping our patients reduce the pain and discomfort caused by damaged nerves without drugs or surgery. I've appeared on Midday Utah and Good Things Utah several different times to talk about the treatment and therapies that we do in our office. In fact, we've helped over 800 people in our office so far overcome their neuropathy pain and return to their normal lives. If you suffer from these types of damaged nerves, you'll want to hear about how Mr. Merrill, one of our patients in our office, overcame the nerve pain that he'd been suffering with for years. Mr. Merrill is pretty typical of a lot of our patients. For a long time, he lived a healthy lifestyle into retirement and loved hiking and doing all the things he did. And then he started developing some of the underlying symptoms that lead to neuropathy, and eventually had to give up to his really active lifestyle. It all started about 6-7 years ago with some of the initial symptoms, and then the tingling and numbing started, and as time passed, it went from one foot to both feet and it continued to progress. He didn't think much about it really until he started experiencing the real pain and burning and tingling and numbness and so forth. And that's we went to his doctor and find out that the pain and numbness was being caused by damaged nerves, and he got the diagnosis with peripheral neuropathy. And he did a lot of different treatments, and the medications that they gave him didn't help. And he got that typical kind of response a lot of people get from their doctors that, well, I guess you'll just have to learn to live with it. And that was his doctor's diagnosis and his recommendations, and all I could do was prescribe pain medications, which he took for a number of years. And they just didn't like how those painkillers made him feel. He just wanted to be able to function better, and he just really had no choice to stay on them if he was able to just do anything on a day-to-day basis. And as it continued to progress, it got to the point where he finally got kind of desperate. And so he started looking on the internet like a lot of people do, and he found a lot of people were getting relief from things like vitamin B shots, hot and cold packs, but they weren't getting any sustained relief, and it wasn't lasting long term. And that's really how the medical community typically treats peripheral neuropathy. Their treatment protocols haven't really changed very much in the last 15 to 25 years. It mainly consists of about 5 medications they're using. They consist of antidepressants, anti-seizure medications, anticonvulsants, steroids, some cortisone injections, and that's really about it. Different types of painkillers and so forth. And so sometimes they use electrical stimulation to block the nerve at the spine going back up to the brain. And as he realized that none of these things were happening, and he turned to the internet, and that's when he found our ad on Facebook. A friend had shared this or forwarded it to him, and that's where he learned about the treatment program that we have here at the Scranton Clinic. And there really is no other program like this out there that we're aware of. We're very proud of the fact that a third to a half of our patient base at any particular time are from outside the state of Utah. We've had patients we've treated from every state in the western United States.
Yeah, my name's Howard Merrill, 70 years old. I've had diabetes for about 5 or 6 years, and I've had problems with my feet for about 1 year, and so I come to Dr. Scranton's office to see if he can help me with my feet problems. I've been here for exactly 1 month today. I've lost 18 pounds. The tingling in my feet is 98% gone. I just have a little tingling in my 2 big toes. I have a little pain or trouble with my right foot on the outside of my foot, but it doesn't seem to hurt me any or bother me walking or anything. Just once in a while when I twist my foot a little which way, it kind of hurts. I've been very, very grateful for coming here to see Dr. Scranton. I'm hoping that in the next month or so, the problems are completely gone with my feet problems, and I can get out and start hiking again in the mountains, which I love to do. I just want to say thank you for Dr. Scranton and his co-workers here. His secretaries or nurses are very nice, very knowledgeable. They've helped me out 100%, and I love the water.
So what is it that helps us to get these results for our neuropathy patients that we treat? We have to have kind of a basic understanding of what really is causing neuropathy. And there's 24 million Americans in the United States with peripheral neuropathy. About 30% of those have diabetes, but 70% of those patients with peripheral neuropathy do not have diabetes. So it's not necessarily a two-way street. Because of the nature of what diabetes does to your body, most people with diabetes will eventually develop peripheral neuropathy, but most people with neuropathy will not necessarily develop diabetes. And so a true peripheral neuropathy typically is being caused by a lack of blood and oxygen flow that's getting to the toes, feet, ankles, and often up into the lower legs. This happens for a variety of different reasons. Oftentimes we may never know why it starts in the first place, but because of that lack of blood flow and oxygen getting to those areas, those tissues are going to start to suffer and deteriorate. And the most sensitive tissue in the body to a lack of oxygen is nerve tissue. So that's typically where that's going to show up first. In some ways that's good because that's your body's alarm system or early warning system to let you know that you're having a problem and that something's wrong. And so that's kind of the canary in the coal mine, or the calm before the storm, to let you know a whole lot worse things, are coming, along after that. And so it's very similar to, if you wrap a rubber band around your finger a few too many times, it starts cutting off the blood flow and circulation there, and you notice a lot of similar types of symptoms where before long it may start turning colors, it may start to swell, you might feel that numb kind of dead feeling, then you start getting the tingling, the pins and needles, and then it just starts to plain hurt. And that's usually when most people would have to pull that rubber band off. And in fact, if they didn't pull it off, that finger is going to turn black and fall off like a sheep's tail. And that's probably one of the most feared complications of dealing with this disease is, the time period when the toes may start to turn purple or black, or people end up with amputations of their toes, feet, ankles. One of the reasons I got into this, treating this area of patients is because my own grandfather suffered with peripheral neuropathy, and he ended up having his entire leg amputated as a result of the peripheral neuropathy. And obviously nothing in his life was ever the same again after that. And so that, really makes me passionate to help people avoid that faith and see their life and their lifestyle so significantly reduced as that progresses to that point. So this is one of the most important things we have to do, is stop that in its tracks, because of that being due to a lack of blood and oxygen flow. The longer that those tissues go without getting the critical blood and oxygen that they need, the worse they're going to get over time. It's going to continually keep progressing, and eventually it may reach a point where it is no longer treatable, and really nothing can be done about it at that point. And we certainly want to catch that before it reaches that stage. So that's the first thing we've got to do, is increase that blood flow and oxygen. And we do that through a number of means, by increasing the amount of nitric oxide in those blood vessels. Now that causes blood vessels to expand significantly. So regardless of the cause, the lack of blood and oxygen getting through there, if we expand the size of those blood vessels significantly, we're going to get a lot more blood and oxygen through there. Now that can take anywhere from several weeks to a month to get enough blood flow and oxygen back to those areas for those nerves to start waking back up and coming back to life. So in the meantime, we're going to use some special types of stimulation to those nerves, and make sure we're doing that every day, because we don't know exactly when those nerves are going to wake back up and come back to life. So as they do start to come back to life and come back online, we want to make sure that we're there right away to stimulate those nerves to start sending those normal signals back to your brain again. And it's a much more natural process of dealing with this anyways, because we're simply replacing that bad aberrant symptom or pain signal with the normal signal. And that way the patient doesn't necessarily have to rely on drugs, or pharmaceuticals, long term to deal with these symptoms and so forth of peripheral neuropathy. So one of the things I'm going to encourage you to do is, we're offering you a very easy way to find out if you, first of all, have peripheral neuropathy. If you're still unsure, or you want a second look at it from another doctor if you've already been diagnosed with that. And we'll also, help you determine, what type of neuropathy that you're dealing with and how bad that's gotten. Because obviously, if patients have progressed, there's a certain point where if they've lost over 85% of the feeling and sensation, we just don't feel comfortable that we're going to be able to turn that around or ever improve that for the patient. And we feel like it's more, in the patient's best interest just to inform them of that and let them know that, we just don't feel comfortable taking them on as a patient, because it's very unlikely at that point that we're ever going to see any sort of, noticeable change or progress or improvement of their condition in any kind whatsoever. So for the next few weeks here, we're offering to do all that, our full neuropathy consultation, examination, where we'll be able to let you know if you do have neuropathy, what type of neuropathy you have, how bad it's gotten, and if it is still treatable, and what can and cannot be done, and what therapies and treatments that you may still be a candidate for at this point. And for the next several weeks, we're offering to do all that for just $49 for anybody that's interested. So, that way we can find out if this breakthrough therapy, may be able to help you. So right now, folks, you really have two choices. You can continue living with the nerve pain and with the tingling, burning, numbness. How I'd strongly advise against that option, because if you have neuropathy, as we just talked about, it means that your nerves are slowly dying. And nerves are like plants. If plants go for a little while without water, you can revive them and kind of bring them back to life. But there's only a certain window of opportunity that you have to do that. And if you wait too long and you come back to try to water that plant, we've all had that experience, there's just nothing that can be done. That plant is never coming back again. And if we wait too long, then there's really nothing that we can do. We'll test you to determine that if you've reached that point or not when you come to the office, and let you know that. But nerve endings, when they become dead and they can't be revived, amputation is one of the few options that's left at that point. And therefore, I strongly encourage you and recommend that you don't wait and consider option number two. So, option number two is, you can take action right away. Call the number or click the button at the bottom of the video to schedule your consultation with me in our office. I suggest you do that, at this moment while it's still on your mind and you're still thinking about it. You may be able to regain that pain-free lifestyle that you're used to and that you've had in the past. And in addition, honestly, I don't know how long it'll be before we can get you in. Whenever we, put these videos out, we often end up with a backlog of new patients with a 2 or 3 week waiting list just to get in. So we get booked up pretty quickly. And so just to make sure that you can get in a reasonable time frame and get times that are, more to your liking, please go ahead and take action and give us that call, and we'll get that scheduled for you right away. Now, if you'd like to potentially reverse your neuropathy and stop the pain, go ahead and call that number or click the button like we said below at the bottom of the video, and let's find out if we can help you. You'll be certainly glad that you did or found out, one way or the other, and it sure beats taking pain medication, the rest of your life. And if you don't want to do this for yourself, do it for those other people in your life, those loved ones, because neuropathy is not only affecting your life, but if you spend a moment and think about it and the loved ones around you, that it's affecting and impacting their lives as well. If not for yourself, do it for them. There's no reason that they should have to live with somebody with neuropathy the rest of their lives as well as the rest of your lives if it was unnecessarily, because it's negatively impacting them in their life as well. And they surely probably love you so much and don't even tell you to the degree that it's affecting them and their happiness and impacting their lifestyle as well. So I thank you for your time, and I look forward to helping you achieve a pain-free lifestyle.